Hello, and welcome to this clinical explainer covering your post-operative care. We know recovery can feel a bit overwhelming, so we're here to calmly and clearly walk you through the essential steps for your healing journey following your procedure at Advanced Dermatologic Surgery. To make sure you're totally prepared, we've broken things down into a clear roadmap. We'll be looking at immediate care and bleeding, bandages and daily care, stitches and activity restrictions, medications and skincare, warning signs, and finally, when you should contact our office. Starting right off with Section 1, immediate care and bleeding, we're going to cover those first critical 24 to 48 hours, where, by the way, some bleeding and swelling are completely expected. If you do happen to notice some bleeding, don't panic, just follow these exact steps. First, you'll want to apply firm, flat, direct pressure right on the surgical site, using some gauze, a clean paper towel, or a washcloth. Now here is the really important part. You have to hold that pressure continuously for a full 30 minutes. Resist the urge to lift up and peek. Just keep the pressure on. Finally, make sure to keep your head elevated for the first 48 hours. You can use a couple of extra pillows or sleep in a recliner, and definitely avoid sleeping on the side where your incision is. So minor bleeding is normal, but we do need to talk about a specific medical complication called a hematoma. This is basically a rapidly expanding, firm or tense swelling that hurts, a dark purple mass, or severe increasing pain. It can even cause sudden problems with your vision, breathing, or swallowing. If you experience these specific severe symptoms, you need to call our office immediately. Let's move on to Section 2, bandages and daily care. Your bandage is really just there to simplify your wound care and catch any bleeding. For the first 24 hours, just leave that large, bulky white dressing exactly where it is. Once 24 hours have passed, you can take it off and safely hop in the shower. Underneath, you're going to see a clear, waterproof bandage with a white pad. If you see a little blood under there, totally normal. That waterproof bandage usually falls off on its own in a day or two. But if you reach day 6 and it's still holding on, go ahead and carefully peel it off yourself. As soon as that waterproof bandage is off, it's time to start your daily wound care routine. Step 1, and this is crucial for preventing infection, wash your hands thoroughly. Next, clean the incision with mild soap and water. Then, apply a generous layer of Vaseline right over the area. Finally, cover it up with a clean bandage. Any clean bandage you have in your medicine cabinet will work just fine. You're going to repeat this every single day until your stitches have completely dissolved. All right, on to Section 3, stitches and activity restrictions. This is all about protecting that repair while your body heals. The magic number for your stitches is 10. The great news is your stitches will dissolve on their own, so you don't even need to come back to the clinic to have them removed. But after 10 days, if you notice any little stitch fragments hanging around, go ahead and gently pluck them out with a pair of clean tweezers. Doing this actually helps you get a much better cosmetic result. Now, let's talk activity. For at least 2 weeks, you need to strictly avoid heavy lifting, heavy cardio, bending over, or any really strenuous activities. We want to avoid anything that raises your blood pressure, makes you break a sweat, or puts direct tension on your wound. Take it easy. Light walking around the neighborhood is perfectly fine, though. Section 4 is medications and skincare. We'll cover pain relief and when you can get back to your normal products. First off, you can go ahead and resume all your usual over-the-counter and prescription meds. If you're dealing with pain, you can take 2 extra-strength Tylenol, which is acetaminophen, and 1 to 2 ibuprofen, like Advil or Motrin. As long as you follow the directions on the bottles, you can actually take these together every 6 hours for relief. Also, if Dr. Hawker or your nurse prescribed an antibiotic, take it exactly as directed, and make sure you eat something with it to avoid an upset stomach. When it comes to your skincare routine, the timeline is exactly 30 days. You really need to wait a full month after your surgery before applying anything like sunscreen, makeup, or scar reduction products like Silogen directly over that surgical site. Give it time to heal first. Section 5, warning signs to watch. Let's make sure you know exactly when to reach out with a concern. It's incredibly important to know the difference between normal healing and an actual infection. Let me reassure you, bruising, weird color changes, and swelling are completely normal. Gravity is real, so that swelling might even travel downward. And sometimes the eyes can temporarily swell shut. Don't panic if that happens. What you do need to watch out for are signs of infection, like a fever over 100.4 degrees, getting the chills, redness that keeps spreading, warmth, or thick yellow or green drainage. If an infection is going to happen, it usually pops up between days 3 and 7. And that brings us to Section 6, contacting our office. You definitely want to give us a call if you experience any of those severe infection or hematoma symptoms we talked about. Also, reach out if you develop intense itching and bright redness around the area, which could mean a bandage allergy. Or, of course, if your bleeding just won't stop after trying that 30 minutes of firm pressure a few times in a row. If you have any questions or concerns, please contact our office. Thank you for choosing Advanced Dermatologic Surgery.